React19, along with 18 COVID-19 vaccine injured and bereaved families, held meetings in Washington, D.C. with over 30 bipartisan senators and representatives to discuss the broken vaccine injury compensation program and the Countermeasure injury compensation program funds, as well as the need for tracking adequate monitoring of COVID-19 vaccine adverse events with ICD-10 diagnosis codes. React19 also met with the FDA Director of Center of Biologics Evaluation and Research, Peter Marks, to present firsthand accounts to the FDA and address concerns raised by the vaccine injured to Dr. Marks and the Principal Deputy Commissioner, Janet Woodcock, for over the last 18 months. The agencies have not disclosed these problems, React19 co-chair Brianne Dressen said. It starts with acknowledgement. FDA Director Peter Marks replied, "We don't have any secrets here. Our goal is to make the public understand the benefits and risks of these vaccines." Over the last 1.5 years, React19, with both medical and scientific researchers, have provided the FDA with supporting documents, active studies, comprehensive analytic data, and surveys to illustrate the need for further extensive investigation. They rely so strongly on the flawed and failing VAERS system that they fail to identify and evaluate safety signals that numerous other countries are now identifying, React19 co-chair Joel Woodcock commented after the call. There is clear evidence they continue to struggle to follow up on VAERS serious adverse events and death reports. Our patient-reported data shows 11% follow-up for serious adverse events, and just 20% for death reports. Follow-up for each of these groups should be 100%. If there is nothing to hide, why not release the raw data to adhere to the FDA's mission to be transparent? Why not release the clinical trial data and the non-public VAERS database? Why not disclose the National Institutes of Health research on the injured? While we understand and acknowledge the COVID-19 vaccines have played a role in quelling the severity of the pandemic, we also understand that the pharmaceuticals come with a risk. The government is obligated to ensure that those harmed are taken care of. However, existing government programs are broken. Time is running out for those suffering, and help is needed promptly. In addition to remedies for compensation programs, we actively seek research, medical recognition, and agency accountability. This comes in the form of COVID-19 vaccines being revamped and added to the vaccine injury compensation program and to be added as retroactive. The Countermeasure injury program has yet to pay out a single claim for COVID-19 vaccine injuries. Details on the CICP and VICP funds, shortfalls, as well as solutions can be found at www.react19.org/CICP. We also are seeking recognition by the health agencies. Without recognition, we do not exist. We cannot access appropriate medical care, disability, or other support that we desperately need. Our lives are literally depending on it. ICD-10 diagnosis codes do not yet exist in the United States, but they exist in Europe and with the World Health Organization. And lastly, we're calling for an investigation and for accountability for proper investigation of adverse events by the health agencies. Despite repeated calls for help, including why the vaccine injured were flown into the NIH for research over a year ago, transparency is lacking with the public.